Hi, this is Dr. Dennis Locke, Sports and Regenerative Medicine. Today we're going to talk about a particular shoulder problem. What happens when you dislocate your shoulder? In particular, we're going to talk about a case of a 17-year-old gymnast who threw her arm backwards and her shoulder popped out of socket. This x-ray will show the head of the humerus, which sits into the shoulder cavity here. And as you can see in this picture, it's clearly been dislocated. The humeral head is now outside the socket area here. Sometimes they'll spontaneously reduce, which the gymnast threw her arm back and and it got back into socket. But when that happens, it's such a violent injury, the soft tissue surrounding it, something has to tear to allow the bone to get down to this position. There has to be a soft tissue injury for it to dislocate. She ended up having a labral tear, and the glenoid labrum is a cartilage lining that overlies the head of the humerus. Then you have the rotator cuff, which is 4 tendons that come together to form a protective covering and also to elevate your arm. So one of these or both can be injured or torn. In this particular case, we're seeing this labral tear here that's clearly demarcated. And so when you see shoulder dislocations, you have to assume there's going to be tissue trauma. So we usually get an MRI. This particular gymnast dislocated it 3 times before she sought treatment with me. So that's a bad sign, because if you keep dislocating it, there's going to be more and more trauma and predispose you to very early arthritis. So that's the importance of early intervention and getting into a regenerative specialist such as myself. Thank you.